Hi, everyone. So, this is a short video talking about counseling 101 topics. And essentially, today we're going to talk about how a counselor structures their session. So, really, rather, the idea for this presentation is talk about the basics of how a session is conducted. And we're going to explore ideas about a beginning, a middle, and an end, and how we can create that container and the benefits of having that sort of structure. So if you give me a second, I'm going to share my screen. So again, this video is essentially geared towards those in the mental health fields, but many of these concepts can be applied for individuals who are meeting with clients, coaches, mentees, etc. Essentially, is if you are in a relationship where you're trying to help someone in a professional manner, it is helpful to have some sort of structure how you conduct your meetings. So again, it could be I could be doing a therapeutic session with a client, or maybe as a faculty advisor role, when I'm meeting with an advisee, it can be helpful to have a beginning, a middle, and an end structure to our session. So again, this is Counseling 101, how to conduct a counseling session. So I've already talked about the session structure, and I think it's really important to have that kind of mentality of we're going to start something, we're going to do the work in the middle, and then we're going to wrap it all up at the end. I know it sounds so simplistic to use this formula, but it can be really beneficial to have that structure. When sessions don't have this type of structure, it can be almost chaotic, and especially from a counseling mental health standpoint, it can cause possible harm. If we're working with if we're working with a client with previous trauma experiences and we're doing trauma work and we don't have a safe container or a safe structure, we can re-traumatize the client. In addition to, if we don't help the client wrap up whatever deep emotional uh, elements were processed, they can leave session being either in a disassociative state, a disorganized state, or even a possibly so checked out mentally that they may be a harm to themselves or others, driving to the car, walking down the street, whatever it may be. So we want to make sure the ending is a time for our clients to kind of reintegrate who they are, kind of find to feel grounded and balanced, and so they can go to function throughout the rest of their day. So again, seems very simplistic structure, but we want our session to be a beginning, a middle, and an end. And again, this is not a unique model. A lot of our counseling helping models will have this structure. Most famously in psychodynamics, we talk a lot about building some sort of container. So the container is we're creating an environment where it's safe enough for our client to explore their unconscious material. And a lot of times that unconscious material is going to have a lot of emotions that may be difficult for the client to contain. So that's why we got to create the container. With that too, the client can leave all that emotionally charged stuff in the room, and that allows it to be processed. If we don't have that container, everything's going to be free form and chaotic. Sticking with psychodynamics, you also hear in Jungian view, we're building temenos. Temenos is the sacred spiritual place, the container to contain these elements. So again, we want some sort of structure. We want a beginning, we want a middle, and we want an end. So moving to the beginning, when we look at the counseling process, and again, this can apply to coaching, mentoring, advising, there's going to be a time where we are somehow starting the process of meeting for the session. So if I'm seeing someone in person, they may be walking from my office to the waiting room. And that journey, depending on how long it is, there can be some small talk going on. What's the weather like? Very superficial kind of elements that are taking place here. On a video call, we still have that kind of small talk occurring. It could be checking in to see if both parties can see and hear each other. Um, and once we have that, there needs to be some cue. Okay, now we're going from small talk into the deep work. Now we're going from just, casual interaction to going to into the professional relationship. So I'm going to give some suggested ways of beginning the session. Understand that this is not the end all be all. And really, the journey for a lot of counseling students is you have to find what works for you. So if we're meeting someone for the first time, the first session, so I'm doing an intake with someone, it could just be simple of, so what brings you in today? You could even go to tell me the story of what led you to counseling, or, the old tried and true method, which doesn't fit for me, but there are some therapists who use this. What ails you? So again, that's the first session. We want to somehow understand what the person is talking about or why they're seeking out counseling. And a lot of times too, as you'll experience as you move on in your counseling career, what they originally say they're here for is rarely the real reason, because again, we're in the beginning stage. The middle stage is where the real work is going to happen. This is just to get the grease, the juice, all that stuff flowing in order to get to the working stage of the session. So that's the first session if I'm meeting someone for the first time. Sequential sessions mean, okay, we already did our intake, we already are establishing the therapeutic relationship. So I've already seen this client. And what can be helpful is in the sequential sessions is exploring, starting off the session, okay, how things been going since the last time we talked or the last time we met. And the one that I use quite a bit is, and this is a solution focused approach. What would be helpful to focus on today? And if what I think can be really helpful is being consistent with our beginning phrases. So if we always start off the session with the same phrase, um, especially for sequential sessions, that can allow that container, that temenos being built. The client knows what to expect. I'm not surprising them with any of the questions. And it just is okay. It's a reminder of we're here to do a certain type of work. So finally, again, with all that, you're going to practice what phrases work for you, what scripts to begin your session works. And the thing to remember is a lot of therapists have scripts or rehearsed lines for beginning and end, but that's just again to build the container because the work is going to happen in the middle. And as you'll experience as a counseling student in practicum and internship, the work that you're doing in the middle is really free formed, a lot of impromptu kind of, we had to equate it to music as very jazz like, where we're seeing what the client's presenting, we're notice what's coming up for ourselves, and then we're applying with that working stage. It's very hard to script how the working stage is going to go. But again, we can start off the beginning and end with some sort of structure. So the middle, so as I mentioned before, the middle is where we tend to utilize various counseling approaches and modalities. It is where the work is taking place. It's going to feel like work. And what's really common is we're going to notice our clients is having more deep emotions. They may be feeling a sense of confusion, feeling stuck. The presenting concern may be the theme of the topic, or some new presenting concern or issue may come up. And they may be feeling of unsure what to do next. And what's very common is we, as a counselor, may be feeling those same feelings. And we call that a parallel process. So if you're feeling stuck and confused, there's a good chance that possibly that's what your client is feeling as well. And so we go from the structure of the beginning. Now there's less structure. And dare I say, there's probably more chaos that is occurring in the middle session. And we're being more spontaneous than calculated at this point. This is where we're probably going to use counseling interventions. We could stick with classic helping skills, such as client-centered therapy, or we can get more directive. Maybe we're going to do empty chair today because that's relevant with what the client's saying. Maybe we'll do some creative artwork. Maybe we'll do some cognitive behavioral therapy. Whatever it may be, that's typically the intervention is going to be occurring in this middle phase. Now, when you're starting off, timing is going to be a skill that you're going to develop. And when you're starting off, you're going to be very in your head and you're going to be kind of losing the feel. And eventually, the more comfortable you get, an inner clock starts to develop. Just like if you use an alarm clock, you'll notice that there's sometimes you start to wake up before the alarm clock goes off. And so you're going to start to build that internal clock. And the thing to remember, whenever you're selecting an intervention to use, it's important to consider, okay, is there adequate time to process this experience with the client? So let's say we got 10 minutes left in session and I feel like sand tray comes to mind. I probably don't have enough time to do sand tray. But let's say we're 15 minutes into session and that gives me probably adequate time to use sand tray and have time to process that. So again, it's just being aware of, okay, what approach am I going to use? And do I have adequate time to utilize it as well as process the experience? Because again, I really believe it can be dangerous if we use an approach and then we don't have time to process it with the client. We lose the ability to promote that reflection, and that's, excuse me, yeah, that reflection piece is key. We know how we learn, especially from experiential standpoint, is through the utilization of reflection. And some would argue that if you use a technique and you don't have time to reflect it, the technique may not have been that beneficial or lost some beneficialness, beneficialness to the process. So we want to have make sure there's some time to process with the client, some time to give a somewhat proper wrapping up. And that leads to the end session. So again, the end stage is a way to wrap up the session, and your structure is going to vary depending on the population you work with, the setting, and your own style. So in some ways, you may be in some settings, excuse me, may be warranted to give a concrete 5-10 minute warning. This is common when working with children in play therapy. You let them know, okay, we got 10 minutes till the end of play, or we got 10 more minutes of play, or whatever prompt it may be. And then you give another 5-minute warning, 5 more minutes till we wrap up, or whatever it may be. When working in other populations, it may be a good time to say this when there's a lull in conversation. You'll just like we'll develop an internal clock. Some clients will develop an internal clock as well. And you'll start to notice when the session is wrapped up. As you get more advanced in your counseling career, you can explore that lull and feel like, is it warranted to go further into the session? Sometimes I've noticed that, especially working with clients for a few years, excuse me, the same client for a few years, I've noticed that when we're coming close to time and I have the availability, it feels like, okay, if we just spend a little time more, we're going to get deeper to that element. And I'm okay sometimes going over that or pushing through the lull. Other times that lull is a good stopping point. So we want to start the wrap up stage, and it could be some sort of cue of, okay, so we're going to start wrap up right now. There's anything you feel you want to focus on or discuss before we come to an end. So the wrapping up stage can be just verbally, they may even be more symbolic or physical. So let's say we're playing with Play-Doh, it could be wrapping up of putting the Play-Doh away, same with sand tray. We could have some sort of ritual or ceremony to recognize the end of the wrap up. It could be just as simple as, okay, we're going to take a few breaths before we come to an end. So how we're going to wrap up is probably going to be unique to the client, but the key is we want some sort of ending. And a lot of times the counselor is taking charge of facilitating the ending process. The thing to remember too, the client is in the middle stage, can feel raw and other unsettling emotions. And so we want to give space to provide integration and reflection if needed. It can just be commenting of, wow, we really went deep today. What was that like for you? Could be a simple induction to talk about the wrap up. In addition to the wrapping up, there's going to be a time where we're going from the working stage to wrapping up, and now we're starting to re-enter the mundane. That small talk is going to start coming up again. And this is telling us, okay, we're now the client's returning to the world outside of the counseling session. And this time it can be talk about future plans. So whether planned for the weekend, again, small talk. We could even, before we get to that, explore what's working, not working for the client in session. What are different styles we could possibly use? And even we can discuss logistics. Maybe it's about payment, scheduling. Maybe the counselor is going on vacation in 3 weeks and wants to give the client a head up. or maybe the client's going on vacation and we need to change the scheduling routine, whatever it may be. But we get to that stuff when we're entering the more mundane conversations and there's less emotionality to it and the client feels more integrated. So to wrap up this lecture, we want to have some sort of structure to our sessions. We want a beginning, we want a middle, we want an end. In the beginning, the counselor is probably going to take more charge, say something to start the process. What would be helpful to focus on today? How things have been going since last time we met? What was it like working on those worksheets? Then we get to the middle stage where, depending on our theory, our client may be taking more charge. There may be less structure, there may be more structure, whatever it may be, but the middle stage, the working stage, is more of a flow. And it's going to vary depending on the client and depending on the session. Then we're going to enter the end stage when the session's coming to the end. The counselor is going to take a little more directive control of managing the ending process. And again, the big thing is we want to make sure the client is feeling integrated the best possibility that we can, and any unsettled emotions feel safe enough to progress and leave in a somewhat safe manner. And then if needed to, we can discuss about logistics for the next session or any other important logistics to cover. So again, thank you for your time. Hope you have a good rest of your day. I'm going to stop sharing. I'm going to end the recording. Thank you.